but I'm just going to get started by telling you who I am. My name is Kelly Papish. I am a nurse practitioner and the director of the APP initiatives at PMD Alliance. And we are so thrilled to have our panel here of experts to talk tonight about access for rural outreach and expanding and improving that rural access for our communities. We have this event today, or this program today, is sponsored by Amneal, and we're so thankful and lucky to have your support. So thank you, Amneal, for supporting us. I want to introduce our panel and before we get started, and just let everybody here know that a couple of the ground rules, I guess. We have the program will be recorded. We do have question and answers. We want this to be interactive, and we want all of our attendees to be able to get out of this what you need to. But because of the large attendance, we will just have you place any questions into the chat box. And at the end of the panel discussion, we will go through the questions and have our panelists answer it there. And so I am just going to have each of our panelists, I'm going to introduce them, and maybe you can just give a little wave so we know which one you are if we can't read the name. So Meredith Hatcher, she grew up in Texas with a brief time in Colorado that she spent in high school. She then returned to Texas to attend Southwestern University in Georgetown. And she attended her physician assistant program at, I might say this wrong, Trevecca Nazarene University in Nashville, Tennessee, and that was for her master's of science in medicine. After graduate school, she began training with Dr. Swallow to pursue her interest in movement disorders. In 2017, she joined the team at Texas Movement Disorder Specialists, where she strives to provide excellent care by supporting patients physically, emotionally, and spiritually. And it's an honor to have worked with movement disorder community for the past 5 years for Meredith. We're so happy to have you here, so thank you.
Thanks,
so much.
Kelly.
And then Stephen Darrow, did I say that last name correct?
Darrow, like rhymes with arrow.
All right, Stephen Darrow, thank you for being here. He received his bachelor's degree in Latin and communication sciences and disorders from the University of Texas in Austin. He completed his Master of Science degree in speech language pathology from the University of Texas at Dallas. He worked for several years in inpatient and outpatient facilities in Dallas, Albuquerque, and Austin before working exclusively with people with Parkinson's. He then launched his own project, Loud and Clear, designed to provide treatment options to people with PD whose needs currently are not met. Thank you for being here, Stephen. Sydney. This is Sydney Hansen, and originally from the land of 10,000 lakes, St. Paul, Minnesota, go Vikings. Sydney received an undergraduate degree in community health from Montana State University in Bozeman, and eventually returned to school and completed her dual registered nurse Master of Science in Nursing program at Vanderbilt in Nashville, Tennessee. After her first year of the program, she was able to complete her MSN portion of the degree remotely, which was largely done while living in New Hampshire, as she simultaneously completed a nurse residency program on a trauma orthoplastics floor. She has worked as a registered nurse holding various positions in trauma, med-surg units, helping with COVID vaccine rollout, as well as aiding in the urgent staffing needs in Montana during the pandemic. She's passionate about listening and learning and being, an essential pillar of care and ensuring that her patients always feel their voice is being heard. She also is currently working in a general neurology group with, and I don't know the name of the group. Sydney, I'm so sorry it's not on here. Your current group?
That's okay. I'm with Intermountain Medical in Billings, Montana.
Wonderful, thank you. And then Mary Jane Berry, native from Texas, born in Corpus Christi and raised in a small town in San Antonio. She attended her graduated UTMB Galveston as a registered nurse. Her background is as a registered nurse, provided many years in her career as an ICU nurse. She finished her career as a Medicaid program nurse and finished as a project manager, and also worked for the HIPAA responsibility implementation for the state of Texas. She currently lives in a retirement community in Sun City. Mary Jane is very involved in activities including delivering Meals on Wheels, volunteering, and doing other things to help with Social Security disability cases. So very involved in her community. Most notably, the reason she's part of this panel today is she is most known for her work with Parkinson's, and she's a facilitator of a 1,200 plus member Parkinson's support group that she has held for over 12 years. She is a caregiver to her husband who has been living with Parkinson's for over 20 years. Thank you so much for being here, Mary Jane. And then Tracy Price, she is a board certified nurse practitioner with a certificate in nurse midwifery. She also earned her Master of Nursing degree at Frontier University in Kentucky. She currently works at Associated Neurology in Kingsport, where she sees general neurology patients. She's been working in the rural general neurology practice for the past 10 years. She is currently a member of the PMD Alliance APP's provider consortium and the Northeast Tennessee chapter for nurse practitioners, American Association of Nurse Practitioners. She's married to her husband for 32 years and they have 2 grown children. They love to camp, hike, and enjoy the beautiful country of Tennessee. So there we have it. Thank you all. And then as the director of the APP initiatives at PMD Alliance, I am so thrilled to be able to facilitate this program tonight as we hope to meet, the needs and give more, I guess, information and understanding about how we can do better to access care and to get the resources in front of our patients, our care partners, our providers. How do we connect with each other? And so I'm so thrilled that we have all of you here on the panel. And so with that, we will get started. All right, so I really want to start with the interesting thing. I don't know if you realized, as I mentioned this in the bios, but Mary Jane, Stephen, and Meredith, they're all in a similar community near Georgetown, Texas, and they have developed relationships with one another and have established a method to be able to connect and to be able to use each other as resources and referrals. And so I just want to start with the 3 of you and ask, how that started. How did you get into beginning these relationships? Georgetown, Texas, it's outside of Austin. It's not completely away from everything, but we know that there's not resources right, within your building, within your clinic. So how did you guys connect? I want to hear the story of this.
Yeah, thank you, Kelly. I think that while we are just outside of Austin, we're not too far. It's me, Dr. Swallow, and one other PA. There's a team of 3 of us. And we have a lot of rural patients that do come to us from all over, as far as Amarillo or El Paso, and quite a few from Abilene, College Station. So we even though we are kind of close to Austin, we're used to dealing with a lot of rural patients, and actually used to have an office up in Waco as well. So still have quite a few that come down from there. And I think one thing that the pandemic did provide for us is that telehealth became more commonplace. If nothing else came of that, at least we did become more familiar with that. Our clinic offers telehealth, and we probably have several every day even that we do. And that's become more commonplace. I think Mary Jane and Stephen could speak to this too, but them offering virtual options and all the online exercise classes that we have now, that has made it so much easier to give information to patients, and they can join all of these opportunities easily online. And I'll pass on to either Stephen or Mary Jane.
I'll speak first then, because Mary Jane is not one to toot her own horn, but really, if every Parkinson community had a Mary Jane, there'd be a lot more of these really, really well-connected healthcare individuals in that community, right? So Mary Jane is the executive director of the GAPS nonprofit, and I'm the chairperson, so we get to work together a ton, and we're talking about exactly the sort of things that Meredith just mentioned, and the whole reason that we're together, which is how to get more people more help. And to your original question, Kelly, I think I think a lot of how that has come about and how that's been cultivated really well is one, that Mary Jane shows up all the time. She gets everybody in a room. Now, sometimes it's up to me to sort how those all fit together, but Mary Jane is just the most open person, so having somebody that is just willing to show up to make those connections. But then on the other side of things, like Meredith and Dr. Swallow and Kinsey is the other PA that works there. They are extremely transparent. They are extremely giving. It's so much information is shared about what resources are available, because I think everybody here wants to really maximize what every single individual who's dealing with Parkinson's or other movement disorders is experiencing. And we kind of all feel like the more resources, the better. And luckily, I feel like we are developing more resources along those lines, like as a community. Yeah, Mary Jane, what do you think?
Well, thank you. And thank you for the kind remarks from both of you guys. Well, I basically started in 2007 when my husband was diagnosed with Parkinson's. And there was a small group of maybe 10 people here in my community of Georgetown. And it was known Georgetown area, but again, only about 10 people were there. The whole deal was my husband was not as open for me to be a part of a community. So just already learning from that, when we have new members, I'm able to share and say, I understand the reluctance. He was expecting a pity party and it wasn't that. But the whole point was it started in 2007, and then I became the facilitator in 2011. We had 40 people on the roster with about 10 to 15 showing up. We now have over 1,200 on the roster, and our largest meeting has been about 150. I'm averaging now about 80 people, and that's a hybrid meeting. We've gone to hybrid. And I agree with what PMDA said, in that that's the only good thing that's really come out of COVID. And then, like Meredith said, with the telehealth, is the hybrid meetings. But we were growing constantly. And part of it is just that personal touch, and to put information out there. And then when they contact us, to personally respond back to them. I meet everybody that has contacted us and everybody that wants information. I followed up with a welcome letter telling about all the different things. But like many of you guys starting maybe a new support group or trying to figure it out, I quickly learned, because I made a lot of mistakes and just put it out there. I had embedded my roster in with my own personal email account. It didn't take long at all to realize I needed to have a separate account. And so I started that. And then I started a website. Again, there's free websites out there. And not that I'm smart about it, I was OJT and was just starting that. Then that got more people involved and interested. And following back with what Meredith said, when we first moved here, there was only one movement disorder specialist. And my husband was seeing a neurologist, but then I heard about a movement disorder specialist, made an appointment. We only had one in Central Texas. We now have 7, which is it's grown. A lot of it has to do with the fact that it's a retirement community and more folks are coming in. But we work closely. In fact, I work closely with all 7 of them and have them come in to be speakers in our meetings. And so we're always doing that. But then again, always trying to provide for people to meet their needs in regards to exercise, vocal exercises. In fact, Stephen has been very good to help us tremendously with that. We had done it before just in singing, but he brought the element of a speech and language pathologist, which has been wonderful. But I've had Meredith as a speaker. So I think using those resources in your area to be speakers and to help share information is how we work so closely together. And we've grown a lot as a support group. So that kind of helped you out, Kelly?
Yeah, that's amazing.
Can I add a couple more things,
Please.
Kelly?
Yes.
I think you touched on this, Mary Jane, but we are just so blessed to have such an amazing support group in our city. Not just the meeting itself, but there's a caregiver support group, there's a DBS support group, there's exercise classes, speech, there's so many different things that I will often, of course, support patients to go to the meeting, but if they aren't comfortable going, they can even just go to some of the exercise groups or there's plenty of other resources. That's just a place for them to start. So I think that it doesn't even have to be, a lot of people are scared to go at first to a meeting, like you said, Dave was at first, but I think it's important to know there's so many other areas of support. And I know Stephen is working on kind of a program for newly diagnosed. We often, of course, try to give as much information as possible up front and every time we see them, but I think having a place that they can go after they're initially diagnosed and they can grow from there is so helpful. So it's not just, we work so closely as a team. I just love that I can send patients off with a pamphlet and a packet of here's the information, don't feel like you're alone. I think that's just a good starting point, and vice versa. Mary Jane often has sent people our way as well. So it's just a beautiful circle of teamwork.
Yep.
That's incredible. Yeah. And so it sounds like, Mary Jane, did you initially make the outreach then to the clinic with Meredith and Kinsey and Dr. Swallow to kind of connect each other?
Well, initially, Dr. Swallow was even in another area. And Meredith, I don't even know if you know this, but he called me up one time when he was at this other area. And he said, Mary Jane, do you think that we might have enough business if we open up a clinic? But I thought he was with another group in Georgetown. I said, oh my goodness, you'll have business like crazy. I know you will. And so I encouraged them to even come. Did you? I don't know. Did you ever know that, Meredith, that
he was about 45 minutes north of Georgetown in Temple, Texas, and I think I've heard that story because it was a big jump for him to make.
It really was.
Well, you're quite the influence in that community, and so we all need a Mary Jane in our communities. We know that. And you're right, Meredith, with the telehealth, the opportunity.
Yes.
One thing that it offered is people who are intimidated or afraid to join a support group, they can join online and they can turn their video off and they could start that way. Sydney and Tracy, you guys are in, different, Tracy, you're with private practice, and Sydney, you're in Intermountain Health. So I'm just wondering, what are your resources like? You're not, you're in Billings, Montana, so you're in a bigger area, but as far as a multidisciplinary center or a clinic with specific needs, what do you do right now to get outreach for your patients to these different ancillary providers or support groups?
Yeah. Like Kelly said, my name is Sydney. I'm a nurse practitioner working in general neuro in Billings, Montana. Thank you guys all for having us. What do we do? That is a great question. So Billings, Montana is about 110, 120,000 population wise. There's 2 hospitals here, the one that I work at and another one. Really lucky that within our own hospital system, a lot of like PT, OT, speech referrals can be made internally, but within the community too, we have not as much as I would like, but other things we can resource out to. So for example, our hospital, the other hospital, a couple nursing homes offer things like the Big and Loud programs. So we'll use those a ton. There's actually this really cool martial arts gym in town that offers boxing classes for people with Parkinson's twice a week. So we try to make them aware of those programs. With support, we are really lucky, like within our own hospital, that we can kind of utilize those different therapies for the most part. And then we also work really closely with neurosurgery, so we can have those DBS conversations. We work really closely with the reps too, so a lot of times they can come in and help us facilitate those, navigating that territory with the patients as well.
Oh, I love that. Thank you. And, it's interesting when I think of this Georgetown team and they have all kind of connected. It's a private practice that Meredith is at, but it's movement disorder. And Sydney, you're at a hospital system, so you have those resources. And then Tracy, you're at a general neurology private practice. So I wonder how that looks. And does that look a lot different as far as what you need to do to be able to get the resources to your patients?
I feel it does look a lot different because we are the only one in what we call the Tri-Cities area, which is basically we live on the very end point of Tennessee, northern point, which we service Virginia, North Carolina, and we service also Kentucky. So it's a huge variation of people that we service. So in our general small area, we do have some, for instance, the Boys Club or Boys and Girls Club, YMCA, has developed a program for the very early morning time for Parkinson's patients, and they have a physical therapist there, one or two, I'm not sure exactly how many they have, but they have those people come in the very early mornings, 5 days a week. So the only people that are in the gym part is the Parkinson's patients to help them and help them, exercise and teach them what they need to do. As far as the outlying counties, that's very hard. I would like to be able to, go out and talk to every YMCA and say, hey, Parkinson's patients need the exercise. They need this. They need all this treatment that needs to be done. But right now we only have it in our physical location. The other thing is that I have been very dominant in talking to neurosurgeons. They're not close to us, anywhere around us to do deep brain stimulation for Parkinson's when they're at that need. I have partnered with 2 neurosurgeons who have agreed to let me do all the treatment and testing here so the patients don't have to drive. And then they have also agreed to do telehealth, which is, of course, as everybody knows, a huge thing now for patients. And then once they do the telehealth, they go for the surgery and then back to me. And I am able to program, start their DBS and get them on the program that they need to be on, and then help them with the exercise routines and everything that they need to do. Our biggest thing, I will say at this point in time, is speech and swallow therapy, and I'm in the process of trying to, work on that and work with the local hospital on specifically doing speech and swallow therapy for Parkinson's patients themselves. But there's a drive and there's some commitment to do in our area, but so far what we've been able to do has been successful.
That's wonderful. I love what you talked about with the advanced therapy. You have made a workaround, right? You guys have a process in place to be able to get people access to advanced therapy. That was one of my questions. What are the biggest barriers that you guys face as far as getting, to your rural patients? What's the biggest barrier? And so just to each of you, I would love to hear that. And then I have a follow-up after that.
So one thing that we had at the very beginning was travel. It's at least 4.5, 5, 6 hours travel for anybody in this area to have the neurosurgical treatment for like DBS and things like that. So with me being able to partner with 2 of these surgeons and explaining to the patients, you only have one trip there, one trip, you go one trip, and they have specifically for our practice, they have started doing 1-day procedures. So the patients are only there a couple of days. And, one of the biggest things is usually they're older. We like to implant younger. That's the goal, is to implant younger. But unfortunately, when it comes to implantation, they're usually older. They don't have a lot of transportation or people to help them. So we try to get, get them implanted as soon as possible to help them. But in the other things, as far as being rural area is, I'm in the process of trying to talk to gyms around the area because everybody loves fitness and everybody loves to exercise and do fitness and things like that. But nobody thinks about the person with the disability or the person that has a disease process that would need specific time to be in the gym because they don't want to be in the gym with somebody that can bench so much or, do all this stuff. They want to be there when there's somebody there to guide them. So I'm trying in the process now, just to get some gyms besides the YMCA to understand this and get the process started for Parkinson's patients.
That's wonderful. Anyone else want to comment on some of the biggest barriers you see to care?
Yeah, I think that you touched on this, Tracy. It's transportation. Thankfully in Austin, we're fairly central, but even still, we hear from a lot of patients that they have to get up early, they have to stay overnight. It's a very difficult thing. These patients, it's a hard travel day. So telehealth has definitely helped, but as Tracy has done, I have worked with general neurologists out in Midland, anywhere remote. We've worked together to help. Maybe we help get someone set up for Duopa, but then they go back to the general neurologist local to them for any adjustments, and we can help communicate between any adjustments. Another big thing that's been helpful is remote DBS programming. So that is just one company that offers that right now, but I think the field will continue moving in that direction. So it's Abbott that has it right now. We have been implanting patients that are more remote for that reason with Abbott. They maybe just have to come for the first couple of programmings, but then we can program them remotely. So
I need to interrupt you.
Oh, go ahead.
That's our part too. That we have had a huge success with remote programming.
Agree completely. It's been huge. So this is more of the advanced therapies, but I think it's important even just for starting out, just having the resources for these patients and having access to general neurologists, movement specialists, that has been limited because of transportation for many years.
Yeah, absolutely. And I wondered, does the inability to be able to see your patients more frequently or only through telehealth, does that play a role in how you treat somebody? Unfortunately, does that, for example, would you be less looking less at the opportunity for advanced therapy for somebody perhaps because they're very remote? And so does that affect their care? And so if so, how do we improve that? Like Tracy's mentioning her workarounds, telehealth. I would love to hear Mary Jane, is the opportunity for more support groups that can offer, specific to like DBS and advanced therapy or medication management, just support groups that really kind of talk to a specific point for these patients who are rural. How do you get those started? Like, how does somebody go about getting those implemented in their communities?
Well, to be honest with you, we're helping get one started right now that's just north of us in Belton. I think Meredith and Stephen know about that. But it was one of our members, and I was getting a lot of phone calls from different people in the Belton, Colleen. These are areas that are about 30 to 50 miles away from us north. And they would say, well, can we join your group? Can we do this or that? And I said, of course you can, but I know somebody that might want to help get one started. Anyway, so just by networking and knowing different people, we've gotten another support group started. But yet that group is coming in on our hybrid, again, using our telemed, Zoom to come into our meetings. But the nice thing is we have also at GAPS have made contacts with so many of the pharmaceutical reps. So for instance, for all three of the DBS groups, I invite them to be sponsors for a meeting. So therefore, they supply the cookies and the water, which, by the way, that's the biggest grab for people to want to come to a meeting if they're going to get cookies and something to drink. And so the different pharmaceutical companies come. So my guys, members, are really starting to know who all of the different reps are. Same way with the Duopa. And then again, they've got a good working relationship with them. And it makes it wonderful because transportation, though, is also another issue. And like Meredith said, fortunately, we do have some avenues. We have a thing that's got like the Drive a Senior program type situation, and we call it Faith in Action. But to help get people in, I know we've had people that come from independent livings on their buses. So I'll even contact the independent living. We've got a meeting coming up. Can you help bring these people? And that's how some of our folks are coming to the meetings. But that is an issue. But more important is just developing these relationships with other pharmaceutical groups and willingness to help other groups and just sharing information. We're constantly sharing. So I feel like we're all, this is what I feel like we're all on the same team, and I want to help everyone. And so even with my newsletter, I say, please take any of the stuff out of my newsletter. I do a monthly newsletter that goes out, and then a bi-weekly email. And so a lot of people use that to share information, and then they pass it forward. So
that's incredible. And I love how you hit on so many different modes to get the message out so that more community members can be accessed and participate. I think you're right. The integration of pharmaceutical industry, device, all of these, this has to be collaboration. We're all looking for the same thing. We are all really trying to give people with Parkinson's and their care partners better access, better quality of life. And that does start with those relationships. And I love that if you build those relationships, they might feel more comfortable attending. They might also be able to expand that. Tracy, I think you had something.
Yeah, I was just going to reiterate on what Mary Jane said, that, I said a lot about DBS and remote, but if you contact your pharmaceutical reps on the newer off-time medications, they go to the patient's house no matter where they live, and they titrate them for the provider. So the patient doesn't have to do anything but be at their home resting, and they provide what they need to help us in practice to let them be comfortable and let them not have any off time, off time is a huge thing when it comes to Parkinson's patients, especially if you're thinking about, I just took my medicine at 4:00. I've got a dinner I'm going to with friends at 6:00. What am I going to do? And, with these new off time medications, that the reps will go out there and titrate them to help them. They don't have to go somewhere to do that, which is a big help for these patients.
Yeah, that's wonderful. Thank you. And I agree with all of that. I think that collaboration, the ability to have an extra support person who's willing to, go out into the community is so vital. Stephen, you probably heard Tracy mention this, maybe your eyes lit up, but she mentioned that they're looking for a speech therapist, right? They're looking for that collaboration. So how do you access rural patients? Is that something that you can do online now? Like, how do you do that in other therapies?
Sure. You're right about all that. So one barrier that hasn't been mentioned yet, because I'm not sure how it applies to APPs, but for speech therapy, you can't really cross state lines. So even though I offer what amounts to telehealth treatment to people with Parkinson's in rural communities, I have to limit it to Texas right now. There are some ways to kind of work. There's some ways to cross state lines, you just can't call it therapy, is kind of what it comes down to. So you will find people that do voice coaching or are involved in Parkinson's wellness. And that's a way to be able to still deliver care across state lines. As opposed to physical therapy, I have a whole team of people a whole care team that will help my clients. And I've spoken, even just in the last 2 weeks, to 6-ish physical therapists. And they all say the same thing, which is for physical therapy, especially with a population like the Parkinson Movement Disorder community, it's got to be in person, at least for a good amount of it, if not for all of it. I feel lucky that that's not quite the same constraint for me. But anybody on this call, including Tracy, if you reach out to me, I can almost definitely connect you to a speech therapist in your state that has certification to work with the Parkinson community. So please do that. I do that all week long.
He's a great resource.
That's amazing. I love that. See, this is so important to be able to connect and meet and network, because this is how you build relationships, just like you said, Mary Jane. So I want to just ask a couple things before we get to question and answer. I know there will be some questions. And so Sydney, I'll go to you first on this one, but do you guys host community fairs or health fairs or programs or education series to the movement community to allow them to meet different people within the community? And if you do, how does that work? How do you get those people there? And do you see that it connects relationships?
Yeah, from more of a patient level, obviously. Yeah. So I know within our hospital, we offer at least an that is welcome to both caregivers and the patients. And it's a full day. It might be a weekend, but I think it's a full day. And throughout the day, there's different classes. I know for the caregivers, there's meditation and how to balance mental wellness. And then there's also different medication updates, neurology lectures, DBS updates, kind of getting everyone on the same page, listening what's new, what's helpful. Aside from that, community involved. We are lucky that, again, Billings being a bigger city in Montana, we are able to do outreach clinics in the more rural areas. So twice, 3, 4 times a month, maybe we'll fly to these different areas, because a lot of you guys are saying too, people are driving from North Dakota, South Dakota, Wyoming, Idaho. They're having to spend the night. They're spending all day in the car. So us being able to go to them is really awesome, because we literally get to meet the patient where they are.
Wow.
Yeah, that sounds like a lot.
The onus off of them.
That's so great that you can offer so many, a variety of things so people can get the information they need for specific things, whether it's, advanced therapy, education, PD education, just networking with ancillary providers in the community, or even perhaps support groups. Do you guys have, I know Georgetown Trio, you guys have some tried and true resources. I just want to hear, do you have go-to resources where you send, whether it's online or where you send your patients, especially if they're rural, where do you always tell them to go? Where do they get their information? I'm just interested to hear that. Where can people go, and what do you know works?
Yeah. So we've actually put together a packet that we give patients when they start out with us, and that includes a lot of information. But I, a couple of years ago, put together a handout specifically for this. What resources do we recommend? Part of that was because we were having patients come back, they Googled read all kinds of scary things on the internet. So finally I said, I'm going to put together a handout of where we would recommend they learn. First and foremost, at the very top is local support group. So I always try to yeah, go Mary Jane. I always try to direct people that direction. But then I also suggest the Parkinson's Foundation. They've got a whole PD library with every topic you can ever want. PMDA, all the online, especially for rural, that's so helpful. Michael J. Fox has some good programs. And then Davis Finney, lately I haven't seen some of their big programs, but for a while they had some really good city programs too. They had one in Austin a couple of years ago. So I think those are some of the big places to learn general information. And then in terms of exercise, there's several good online ones that I'll suggest as well. And Mary Jane, Stephen, you may have some other things to add as well.
Well, I'll go in and speak up here. Like I say, when I get a brand new person, and they come in, and again, I do the personal touch by actually talking to them, and I'll either get it through our website that sends us because they sent an inquiry or referral from a friend, or either they just call me blank. And I advertise in several resources, magazines, or even in our local newspaper, so that they know about our support group. And that's kind of how that'll come. But a lot of them are referrals from doctors and from their friends. But then they get a personal letter, and it has links and tells them all the opportunities of things that they can offer. But everything is directing them back to our website. And that was one of the things that, again, this is a free website. So some of you maybe that are in a doctor's practice or a hospital practice, you might have even fancier stuff, but it really meets our needs. And I update it every day by sending, because I signed up for all the foundations, all of the different foundations, and again, of course, including PMDA. And so when y'all send out for about upcoming topics and so forth like that, that gets into our website under upcoming events, and people peruse it daily to find out what do they want to go to, what do they want to sign up for, one of which, of course, it could be, conferences coming up or different things, different trainings, because we, again, being close to Austin, there are other trainings that are in our area. We just recently had a caregiver conference, and so we're very involved. So it's just reaching out and getting to the public and sharing information through the emails, but the website is a big resource for us. Okay, Stephen, anything?
Yeah, sure. I'll add just a little bit. It sounds like we're all talking about how, especially the more central you are, you become the de facto kind of beacon for all the rural community around you. I think Mary Jane and Meredith spoke excellently to the kind of the how. I'll just give a couple real specific examples. There's a group in Austin called Power for Parkinson's that they offer, I think every single day of the week, they offer some chair exercise routines. So, that's more physical therapy, balance, that sort of thing. There's a lady named Samantha Ellendary, this is for voice therapy, who is out of the DFW area, Richardson, Texas, who started Parkinson Voice Project. So if you've ever heard of Speak Out, that is their protocol. She offers something, if it's not every day, it's like 2 or 3 days a week. I think she streams it on YouTube. I offer, and this is all free, by the way. All of these things are free. I offer a voice class on Fridays, get people from all over the world. I guess not really in the Pacific because it's the middle of the night there, but we frequently have people from Europe joining us and all over the country. Then there's also, one of the things that we've created is we have an app. This is again for voice therapy or a voice exercise that you can download to practice asynchronously without a speech language pathologist with you. So those are the 4 things that when people are talking about, hey, specifically to exercise, physical and speech exercise, those are usually my go-to recommendations.
Thank you. You should put the link here, or we can send it out to our attendees, because I was going to ask.
I'll put the links there.
Yeah, what I have people ask all the time, are there websites I can go to do my speech therapy exercises? And so if they aren't meeting with somebody, where can they go to learn that? So the app would be excellent. I love that. And then, one of my thoughts was our reps for different products or device. they are a really good resource for providers. They're a really good resource for ancillary support group leaders and for patients and care partners, because they might know, oh, did you know Mary Jane hosts this support group? So they are somebody who probably is connected in the world of PD or movement, where they may know of other local community resources. So I would always recommend people to look at and talk to their their reps as well. Sydney or Tracy, any other go-to resources that you send your patients to online?
I think in the local setting, kind of things I had already mentioned, the like boxing club, the martial arts group that meets here has online exercises as well. And same with, oh my gosh, I'm totally drawing a blank right now. Some of the therapists will offer some of the exercises done like with the Big and Loud programs, have YouTube videos for those as well.
I normally send my patients, if they want to look stuff up online, to the Parkinson's Foundation and then Michael J. Fox. So if you will definitely post those speech and all those sites, I will be very happy to let my patients know, because speech therapy is one of the hardest things that we have around here for Parkinson's patients, actually for Parkinson's, any type of speech. This area is not very vivid in speech therapy. So all those links that you could post, that would be very fabulous for my area and my practice.
Thank you. I love this discussion. I think it's so important to hear all the different ways that we can get the resources to our patients. I want to go to some of the questions in the chat. And one of those, I think it was echoed by a couple of participants, but just asking, like, how do you get a movement disorder specialist or even neurologist with expertise in movement disorders to come to an area that might be more rural? And what would it take to, like, how many patients, what's realistic to make a clinic viable? What do you guys think? Dr. Swallow did this. So Meredith or the Georgetown group, you might have some idea, and Tracy, you're in private practice. What do you think that takes to get a specialist in the area outside of the lack of enough specialists?
Yeah, it's definitely a challenge. And I think here for us, Dr. Swallow, like we had mentioned earlier, started out in Temple with kind of a bigger facility, and then left and opened his own private practice in both Waco and then Georgetown. So we did actually try to reach out to smaller communities. And I will say it was actually a challenge in Waco. It was not a problem of having enough patients. We had plenty of patients. It was more of a problem of the resources and our ability to take care of that many patients. We currently have almost 4,000 patients for 3 providers. So that's a lot. Not all of those are active. There are some that maybe have moved, but it's not necessarily a number of patients. It's more just that there are only so many movement specialists to go around, and only so many movement trained PAs or nurse practitioners. I think that will improve with time. Like Mary Jane said, there used to only be 1 in the area. Now there are 7. But we actually ended up having to close the Waco location just because we had to focus our efforts on one spot. The other important thing was just that it's important to have the support in the community. You do need to have a neurosurgeon. You do need to have a gastroenterologist for DUOPA. You need to have access to therapies. And sometimes in smaller places that can be limited somewhat. So it's doable, but it does come with some challenges.
Thank you. One thing that comes to mind, of course, being the director of advanced practice provider initiatives at PMD Alliance, is that we know there's only about 40 movement disorder specialists that come into practice every year, while the number of people diagnosed with Parkinson's is growing faster than any other neurologic disorder. So there's a gap, right? And so one thing that we can do is continue to motivate, train, and invest in advanced practice providers, because there's a lot of us. And so if we can get more into these rural communities as well, we over time develop expert clinical management skills as well. And so it's another component to add APPs into the community.
That's
There
what I
was-
was going to
yeah.
mention, Kelly, really quickly too, is I think Kelly and PMDA, they're doing a wonderful job helping to get the word out for more APPs and movement, PAs and nurse practitioners, and providing the trainings. We had a brand new conference this year, not just for us, but for movement specialists to all come together. And so I think this will improve over time, but it is a challenge that Kelly and PMDA is working very hard on.
Yeah.
One thing I want to add to that too is that since the conference that we went to in Washington, I have been in meetings with my physician providers about how to become a movement specialist as an APP. And we've been discussing that because there's no movement specialist around us. So if I have to send, or a patient needs to go to a movement specialist for the on-off testing or whatever needs to be done, then that's a 4.5 hour, 5 hour drive. So you're talking meals, room, gas, and the way things are now, it's just not feasible for some of these elderly patients that are on Social Security. So, we've been in our area and our practice been trying to figure out, and the doctors are trying to help me become a movement specialist to serve the Tri-Cities area, because we don't have that. So there's always that possibility of, if somebody wants to go into that and specialize, especially if you're in a rural area like I am, to be able to do that. And I encourage anybody, that wants to do that, to make sure that, they do the steps they need to do that, because it is possible.
Mm-hmm. Thank you. Yeah. And, PMD Alliance, like you guys mentioned, we are working hard on initiatives to get more training to advanced practice providers so that we can get to more rural areas and make greater outreach. There's also free education courses that PMD Alliance offers for providers, but also for, we host online and programs. A lot of those are recorded. So even just, the support groups that are online, you can go to our website and find a lot of these programs, or watch a recording and get a lot of information, so that a patient or a person with Parkinson's or their care partner can get so much more education and information going into that appointment. Ken, yes, go ahead, please. Welcome. Oh, you're on mute. Sorry. I think we can unmute you.
There, can you hear me?
Yes.
Thank you. Here's a thought. You guys in Texas have done, in the Georgetown area, have done something rather special in my view. And I know Gillian has the issue in the Bozeman area where she is. I have it I'm in Southern Oregon, Medford being the largest city, if you will. Like for me, I'd have to go either all 6 hours up to Portland or 6 hours down to San Francisco for a movement disorder specialist. And I know that Montana and Oregon, at least it's not even our state, but our areas are not the only ones in the country where this problem exists. And rather than taking it on a very local or parochial level, is there a way possibly PMD Alliance could coordinate or spearhead? I'm not saying do the work. I mean, we can do the work, but where we can take create an initiative to get more movement disorder specialists in more rural areas throughout the country, or at least throughout the areas where PMD Alliance has really got more outreach right now. Do you know what I'm saying? Instead of like me going ahead and finding out about the California registry and me doing it individually, and so I solved the problem here. Well, can't we think bigger and try to solve the problem a little bit more universally? Does that make sense?
It does. I love your thoughts, and I appreciate your participation and your input. We have our director of like community access and education and rural outreach on the call, and she's taking notes on this. This is really important to PMD Alliance. That's why this is our first panel on rural outreach and access, because we know how important it is. So we do have some initiatives to continue to expand that. One thing that's really amazing is physicians coming out of practice, advanced practice providers too, but physicians, they can, through the student loans and student loan forgiveness programs, they get, those loans forgiven when they're at a more rural area. And I think that's really attractive to people. A lot of people don't know about that. A lot of movement disorder specialists and fellows that come into practice know that they want to be able to make a difference in their community. So it kind of matches up. We do have heat maps that we've created of all of the people that we make outreach to through PMD Alliance. So we can kind of identify, and if that looks like it's not lined up with where all these people are lined up with a big city, it might be more of an area to focus on and to get more outreach to. So we're on to the same thought, Ken. And I'm sure that, after this, we'll continue to follow up with more, but Clemmy is our director on that. She is working on initiatives just like that. So maybe you'd be someone great to bring on to some more discussions with that.
And maybe a first step with picking up on what something Susan Jennings was saying is maybe a first step might be, let's see if we can't get a PD registry in every state, because that's one way that we find out the numbers by zip code, and then we can start narrowing in or focusing on the areas where we have a lot of patients and few movement disorder specialists, if any. And that gives us a way to know or understand how to focus our efforts. Is that okay, Clemmy?
Yes, absolutely. Sorry. I have two kids that just ran into my room. I'm sorry, everybody. But Bruce, please, you wanted to mention something. Please do.
Just what I wanted to say is, Ken, thank you for, I thank everybody for their comments, their participation, and Ken, what you bring up is so at the core of the challenges is that I'm working with Kelly. I'm a contractor with the PMD Alliance, and working with Kelly to look at, as she was discussing, the kind of additional training for advanced practice providers, what we're seeing is that there's a prediction that there will be a decrease in movement disorder specialists. So I believe that the solutions are going to be really nuanced and require a lot of creativity. But just hearing you, I believe that this is something that we really do need to be discussing more and really finding what are solutions that can make some traction, because Georgetown has done amazing things and they're an exception to the rule for rural America. I know where I am, there's pretty much nothing.
Thank you so much, Bruce. Yeah, I think this is just the beginning of a kickoff for many panels to come, because we have so many more people to make outreach to and to get information to, and to know that there's possibilities and methods to improve connections and connectedness. I want to respect everybody's time, and we are at the end of our hour here. So yes, Mary Jane, please. You're on mute. You're on mute.
Okay, just one real quickie. I had several patients, obviously being in this 12 years as a support group leader, that have moved, and they'd say, Mary Jane, who's a doctor in such and such in this state and this state. I just put it in the chat. There is a movement disorder organization of doctors, and they have a registry. And I have actually perused that before to share and to give them, and you put in a zip code and blah, blah, blah. Anyway, I just did it for Austin just to make sure it was still pretty current, and it just popped right on up for our area. So there is a beginning of a registry to find them, but yet I know there's a shortage of them, of docs.
Yeah.
I mean, even Dr. Swallow, I mean, what is it now, Meredith? About, oh gosh, 4 to 6 months, not longer, just to get in to see them.
It's at
And-
least 6 months for a new consult. Yeah. So
when people, new people come and they ask me, Mary Jane, who's a doc? Well, I send them out all 7 of the docs that I know in our area, and I go and tell them, go on and set up an appointment with at least a couple of them. It's nothing wrong to get a second opinion, and whoever you get in first, and you can go and check this one, because you really want to match your personality with their personality to make sure everybody gets along. But anyway, I just wanted to share that real quick. Sorry to slow you down, Kelly.
No, not at all. I appreciate that. I think we're here for the resources. And so I agree, the Movement Disorder Society, the MDS website has a list of APPs actually and physicians. So if anyone's registered in there, you can see where their location is. You know, if you have further questions after this, please write into PMD Alliance on our website. We can get some answers and some feedback to you. Those of you that, you know, want to be more involved and are motivated, we will make outreach to you because we want to be part of getting the care to the people that need it in the right places. And so again, we want to just say thank you so much to our panelists for being here. You guys were just wonderful. And Amneal, thank you for supporting us today, and everyone for being here. So thank you so much. With that, I will wish you a wonderful evening, and come on to our website for anything that you need more.
This is our mantra right here that we do here in Georgetown. I'll get it all straight. Somebody asked to see what was on my shirt. We ain't giving up hope. No, and we're not here either. So anyway.
Amazing. Thank you so much. Thank you, everybody.
thank you, everyone.
Thank you.
Bye, guys. Thank
Thank
you.
you.